You are probably eating at least one of these foods right now, maybe two or three of them. You eat them because everything you have ever been told about healthy eating points directly at them. They sit in the produce section and the health food aisle and the carefully curated wellness content you scroll through in the morning. They are on the approved lists. They are in the smoothie recipes and the meal plans and the doctor-recommended diets. And for most people, at most ages, the concern is minimal. But after 60, the kidneys change in ways that flip the script on several of these foods completely. And the people eating them every day, with the best intentions and genuine commitment to their health, have no idea that the very foods they are trusting to protect them may be quietly accelerating the decline of two organs that, once compromised past a certain threshold, cannot be repaired. They can only be managed. That is the part that nobody says directly enough. Kidney damage is not reversible in the way that liver damage is, or the way that cardiovascular risk can be meaningfully reduced with the right interventions. When kidney function is lost, it is lost. The filtration capacity that kept your blood clean, that regulated your fluid balance and your electrolytes and your blood pressure and your bone density and your red blood cell production, all of it running on kidneys that were silently bearing the wrong kind of load for years. It does not come back the way a healed muscle comes back. You live with what remains. And the distance between what remains and what would have remained if you had known what you are about to know is a distance that matters enormously for the quality of every year that follows. If this kind of honest, specific health information is what you have been searching for, hit like and subscribe right now. This is Dr. Victor Lang, and what drives this channel is the conviction that you deserve to understand your own biology with enough precision to actually protect it. Here is what changes in the kidneys after 60, because without this foundation, the rest of the story does not have its full weight. Your kidneys filter approximately 180 liters of blood every single day. Every minute of your life, blood is moving through the intricate filtration structures inside your kidneys called nephrons, and waste products, excess minerals, and metabolic byproducts are being separated out, concentrated, and eliminated in urine, while everything your body needs is returned to circulation. When you are young, you have roughly 2 million nephrons between your two kidneys, and you have enormous reserve capacity built in. You could lose 40% of your nephrons and still have kidney function that looks normal on a standard blood test. This reserve capacity is protective, but it is also deceptive because it means kidney damage accumulates silently for years before it shows up in the numbers your doctor checks. After 60, the rate of nephron loss accelerates, the filtering membranes thicken, the small vessels inside the kidneys stiffen, just as vessels stiffen throughout the body. The kidneys become less efficient at concentrating urine, less efficient at managing the precise balance of minerals that every cell in your body depends on, and less capable of handling the filtration burden that certain high-load foods create. Research published in nephrology journals consistently confirms that kidney function declines by roughly 1% per year after the age of 40 in healthy adults, and that this decline accelerates under specific dietary conditions that are entirely preventable if you know what they are. The first food on this list is one that will genuinely surprise most people, and I want to be specific about why, because the mechanism matters more than the warning label. Spinach. Not in small quantities occasionally, but spinach eaten in the large daily servings that have become common in the green smoothie and superfood culture of the past decade. Spinach is extraordinarily high in oxalate, a naturally occurring compound that, in the kidneys of younger adults with robust filtration capacity, is generally processed and eliminated without significant issue. But as kidney function declines with age, the efficiency of oxalate elimination decreases. Oxalate begins to accumulate. It binds with calcium in the urinary tract, forming calcium oxalate crystals that are the most common type of kidney stone. But the damage is not limited to stones alone. In people with reduced kidney function, chronically elevated oxalate can cause oxalate deposits to form directly in kidney tissue, a condition called oxalate nephropathy, and this causes direct structural damage to the nephrons that filter your blood. Studies looking at the diets of people over 60 with progressive kidney disease show spinach, beet greens, and Swiss chard, all extremely high oxalate greens, appearing with striking frequency in the dietary histories of patients whose decline accelerated without an obvious explanation. The smoothie someone was drinking every morning for their health was silently contributing to the problem their nephrologist was trying to slow down. This does not mean spinach is universally dangerous or that you should never eat it. It means that the serving sizes being promoted in wellness culture, The 2 to 3 large handfuls in a daily smoothie are calibrated for kidneys that are not yet 60 years old. For people over 60, particularly those with any family history of kidney disease, or those who have ever had a kidney stone, or those who already show early signs of reduced filtration on their lab work, the daily high oxalate green smoothie is a genuine risk factor wearing the mask of a health food. The second food is one that carries perhaps the most misleading health reputation of anything on this list: protein powder, specifically the high-dose daily use of concentrated protein supplements that has become normalized not just in athletic communities, but in the general over 60 population, where protein intake has been widely promoted as essential for preventing muscle loss. And it is true that protein is important for maintaining muscle mass as you age. The problem is that the kidneys are the organs responsible for eliminating the nitrogen waste products that result from protein metabolism. Urea, creatinine, and other nitrogenous compounds produced when your body breaks down protein for energy or for muscle synthesis have to be filtered out of the blood and excreted in urine. This filtration process is one of the most metabolically demanding tasks the kidneys perform, and it scales directly with protein load. When protein intake is very high, the kidneys have to work harder. Blood flow to the kidneys increases. Pressure inside the filtration structures rises. Over time, this elevated filtration pressure, called hyperfiltration, causes structural changes in the glomeruli, the tiny filtering units inside each nephron, that accelerate their decline. In younger kidneys with full reserve capacity, the body can generally compensate. In aging kidneys already losing nephrons, chronic hyperfiltration is a recognized driver of accelerated functional decline. Clinical guidelines from nephrology organizations specifically recommend that people with any degree of reduced kidney function moderate protein intake rather than increase it, directly contradicting the general aging and muscle loss messaging that pushes protein supplementation without qualification. The protein powder that is supposed to be protecting your muscle may be silently costing you kidney function you cannot get back. The third food requires a moment of particular care, because it involves something that has been celebrated for heart health benefits that are real and well documented, and this is dark chocolate and cocoa. Specifically, raw cacao powder and high cacao dark chocolate consumed in the amounts that wellness culture recommends for their flavanol content. The flavonols in cocoa genuinely support cardiovascular function, reduce blood pressure, and improve endothelial health. This is not disputed. But cocoa is also extraordinarily high in oxalate, even higher than spinach gram for gram, and it also contains significant amounts of phosphorus, the mineral whose regulation becomes critically impaired when kidney function declines. Phosphorus balance is one of the kidney's most important jobs. Healthy kidneys adjust phosphorus excretion precisely to maintain blood phosphorus in a narrow range that is compatible with bone health, heart health, and cellular function. As kidney function declines, phosphorus accumulates in the blood. Elevated blood phosphorus pulls calcium out of bones, calcifies blood vessels, and dramatically accelerates cardiovascular disease in people with kidney disease, which is a primary reason why kidney disease patients have cardiovascular mortality rates that are many times higher than the general population. A daily tablespoon of raw cacao in a morning smoothie or a daily serving of dark chocolate, consumed with the genuine belief that they are protecting the heart, can meaningfully increase phosphorus load in kidneys that are no longer managing phosphorus with their former efficiency. The heart benefit does not disappear, but it exists alongside a kidney and bone risk that the person drinking the cacao smoothie has never been told about. The fourth food is something that feels almost untouchably pure in its health associations, and that is starfruit. This one is less about widespread daily consumption and more about a specific, serious, and almost completely unknown danger that deserves to be known widely. Starfruit, also called carambola, contains a neurotoxin called caramboxin that healthy kidneys eliminate rapidly and completely. In healthy adults, starfruit consumption, even in modest amounts, produces no symptoms because caramboxin never accumulates to a level where it causes harm. But in people with even moderately reduced kidney function, caramboxin is not cleared efficiently. It builds up in the blood. And the neurological effects, which range from hiccups and confusion to seizures and death, have been documented in case reports from nephrology literature going back decades. People who do not know they have reduced kidney function, and there are millions of them because the early decline is symptom-free, have consumed starfruit without any concern and experienced serious neurological events. This is not a theoretical risk. It is a documented, recurring clinical event that nephrologists know about, and the general public almost universally does not. Star fruit is sold in American grocery stores as a tropical health food. It appears in fruit salads at restaurants and hotel buffets. And for someone with undiagnosed chronic kidney disease, which affects an estimated 15% of American adults, it is a genuine danger. The fifth food is perhaps the most emotionally challenging reveal on this list, because it is one that sits at the center of some of the most beloved wellness rituals of the past decade. Green tea, consumed in high daily quantities, 2, 3, 4 cups a day, sometimes more, by people who have read extensively about its antioxidant content, its metabolism-supporting effects, its cancer-protective associations, its role in longevity cultures around the world. All of that research exists, and most of it is legitimate. But green tea is also a meaningful source of oxalate. In the moderate consumption patterns associated with longevity research, 1 to 2 cups per day, the oxalate contribution is manageable. But in the high consumption patterns that have become common among health-conscious older adults who treat green tea as a therapeutic beverage to be consumed freely throughout the day, the cumulative oxalate load becomes significant. Combined with a spinach smoothie and dark chocolate, the daily oxalate burden can reach levels that create genuine risk for kidneys, whose filtration efficiency is already in natural age-related decline. The individual foods each seem benign. The combination, consumed daily, in the quantities that wellness culture encourages, creates a cumulative load that nephrology research increasingly recognizes as a contributor to the progressive kidney disease that develops in people with no other obvious risk factor. The overarching message threading through all 5 of these foods is not that healthy eating is dangerous or that you should be afraid of nutritious foods. The message is more specific and more important than that. The research that supports the health benefits of spinach, protein, cocoa, and green tea was largely conducted in populations that were not uniformly over 60 and was largely not designed with kidney function decline as the primary outcome. The serving sizes that wellness culture promotes are often based on benefit maximization logic rather than risk stratification logic. And after 60, when kidney function is in natural and measurable decline, when the reserve capacity that made these foods safe at 40 is no longer as available, the risk-to-benefit calculation changes, not catastrophically, not for everyone, and not immediately, but meaningfully enough that you deserve to have the information and make the choice yourself, with eyes open. What you can do right now is meaningful and uncomplicated. Rotate your leafy greens rather than defaulting to spinach every day. Low oxalate greens like kale, cabbage, and lettuce give you similar nutritional profiles without the oxalate burden. Get your protein from whole food sources, which carry their nitrogen load in a more gradual, kidney-manageable form compared to concentrated protein powders consumed multiple times daily. Enjoy dark chocolate and cacao in true moderation, a small piece or a teaspoon, rather than in the large therapeutic doses that some wellness content recommends. Never eat star fruit if there is any possibility your kidney function has declined, and given the prevalence of undiagnosed kidney disease, a simple creatinine blood test to know where you stand is one of the most valuable preventive steps you can take. And with green tea, stay in the 1 to 2 cup daily range rather than treating it as an unlimited health beverage. None of these adjustments requires dramatic sacrifice. None of them removes foods you love from your life. They require the kind of calibration that comes from having accurate information about how your body actually works at the age you actually are, rather than the generalized wellness messaging that treats health recommendations as equally applicable across the entire lifespan. Your kidneys are doing something extraordinary and invisible on your behalf every single minute of every day. They are filtering your blood, balancing your chemistry, protecting your bones, managing your blood pressure, and keeping the biochemical environment inside your body within the precise parameters that every organ in your body depends on to function. They are doing all of this quietly, without complaint, without symptoms, without asking you for anything except that you understand what loads them and what protects them, and they are doing it with a reserve capacity that is smaller than it was at 40, that will be smaller still at 70, and that cannot be restored once it is gone. The foods we have talked about today are not villains, but they are examples of something deeply important. Good intentions and accurate information are not the same thing. You can be entirely committed to your health and still be working with an information set that has gaps in it, gaps that matter more after 60 than they did before 60, gaps that the people who care about you deserve to have filled. The time to adjust is not after a kidney disease diagnosis changes the options available to you. The time is now, when small, informed changes still have the power to change the entire trajectory. Tell me in the comments which of these 5 surprised you the most. I genuinely want to know what landed differently than you expected, and your response helps other people who are reading those comments understand which of these risks they may not have considered. And if someone you care about is over 60 and eating these foods every day in the genuine belief that they are protecting their health, please share this video with them, because this is exactly the kind of specific biology-grounded information that makes a real difference in the real life of a real person, and the people you love deserve to have it. The kidneys will not tell you when they are struggling. They will simply one day have less capacity than they did before. What you do with what you know right now is the only variable that is still fully in your hands.